Good evening, it's 8 o'clock, and welcome to today's episode of Marvelous Medicine, which is about tackling health related misinformation. The speaker is Dr. Jimmy Mathew. He's a professor of plastic surgery and a microsurgeon at Amrita Institute of Medical Sciences, Kochi. Jimmy did his MBBS from Thrissur Medical College, MS General Surgery from Jimy, Pondicherry, and MCH in Reconstructive Surgery from Calicut Medical College. He also has a master's in psychology. His areas of interest are hand surgery, including replantation and transplantation. He was part of the surgical team that did South Asia's first hand transplantation. He has about 50 publications in national and international journals to his credit. Jimy is an avid blogger with a huge following and engages with the general public on both medical and non-medical matters. He has published 7 books, first of which was called The Stethoscope and the Scalpel. Thank you, Jimy, for agreeing to do this session. I request Patta Radhakrishna to introduce our moderators, Professor K. Sridhar and Dr. Shivaram.
It's my privilege to introduce Dr. Sridhar, my teacher, guide, philosopher, and many others. And if I had to talk about him, it'll take a long, long time. But in short, I knew him from the time he was a consultant plastic hand reconstructive surgeon under Dr. Venkateswamy in Stanley Medical College about 4 decades ago. Following that, he was a senior consultant plastic surgeon in Apollo Hospitals. Subsequently, he moved to SRM Institute of Medical Sciences, and actually is is the architect of SIMS. He built the institution brick by brick, and he is the one who made the state-of-the-art operation theaters there. He was the senior vice president and head of the Institute of Craniofacial Aesthetic and Plastic Surgery there. From there, he got elevated to the Pro Vice Chancellor of SRM University. He was also a member of Planning Commission, Tamil Nadu government, and he was an advisor to Omandar Super Specialty Hospital. And then among the many other things he was involved in was spirituality, spiritual literature. Then his visit to Mount Kailash and things like that. And then he's also written a book called Forgotten Freedom Fighter. I'm sure he would have written more, but this is one which is written recently. And more than anything, he's had almost all the possible positions in Indian Association of Plastic Surgery, including the national president, and is a mentor to a generation of surgeons. That is Dr. Sridhar to you. Dr. Shivaram is a good friend and contemporary. He is a senior consultative plastic reconstructive surgeon at Apollo Hospitals, Chennai. He did his MBBS from Madras Medical College and DNB from Perambur Railway Hospital. Subsequently, did his FRCS Edinburgh and all FRCS plastic surgery. And after a long tenure in the UK, he returned back to India, where now presently he is a consultant in Apollo. And then he's also a tutor, teacher, mentor, and a trainee for the Royal College Edinburgh. He's a DNB teacher for last about 15 years, and he's also an associate editor for the Indian Journal of Plastic Surgery. He has authored many books and wrote book chapters, and his present interest is, in addition to philosophy, Carnatic music. He, I think, practices, learns, and he breathes Carnatic music these days. Dr. Shivaram. Vidya, back to you.
Thank you, Radha, for the introduction. Over to you, Jimy.
Hello, thank you. Thank you for inviting me to this talk. It's wonderful to be here. Thank you, Vidya and Dr. Patta. And it's rather humbling to talk before the august audience and with Dr. Sridhar and Dr. Shivaram Bharadwaj. Now the talk is on misinformation, health misinformation. This health misinformation is not a small thing, just last year, last week, I was talking to my cardiologist friend, and he just told me about one of his patients. So he was undergoing, he came to the hospital with heart pain. I mean, when you have pain, you are immediately taken to the hospital. And an angioplasty was done. But post-angioplasty, he absolutely refused to take any medications, and it got blocked. and he had a rearrest and he died. And apparently it was because of some misinformation handed to him by his friend. So even before his thing, even before his uh, present heart attack, he was actually an avid consumer of health misinformation. So health misinformation can actually kill people. All right. So let us go into, I try to share my screen and let's go into the PowerPoint. Can you see my slide?
Yes, Jimmy.
Yeah. I have titled my presentation Mis and Disinformation, a Modern Scourge. It's not strictly speaking modern, but we'll just go into the beast and look at the beast itself before seeing how to counter it. Actually, I'll be talking more generally about misinformation, health misinformation. We can have a discussion later on how to counter it properly because there are no real answers. It's a big problem all over the world. In fact, just the other day, I saw a video, a very handsome person, just like our Shivaram Bharadwaj sir, and with the distinguished look of our Sridhar, Dr. Sridhar sir, talking very confidently in a WhatsApp video. Piss, crap, and sweat. In Malayalam, he was talking. Piss, crap, and sweat. That's all you need. You don't require any medical tests or any medical checkups in your life. Just drink a lot of water, at least 12 glasses of water a day. See that you are pouring out urine. Eat some oranges a day and see that you are passing motion nicely. And work out a bit, go into the sun and see that you are sweating profusely. And that's all you need. That means that your body is working fine. This is what he was saying. Then around 10, 15 years, 15 years back, a WhatsApp forward was running the rounds in Kerala. And in that, a person was telling very confident, so it's a voice message. In that, a person was very confidently saying, drink water and avoid angioplasty. That's what he was saying. I'm sure what he meant was that if you drink a lot of water, all the atherosclerotic plaques will get washed away and you will not get heart attack ever again and you won't require angioplasty. And that info clinic, one organization, some of us, writer doctors, were trying to debunk this health misinformation at that point of time. And then we found out who the origin of this particular voice message was. He was actually an irrigation department, an engineer who retired from the irrigation department. And it was his common sense which told him that when you have a large pressure head in his, irrigation, his field, when you have a large pressure head, all the blocks in the pipe will get washed off with the, when the water comes. And that was the basis on which he based his voice message. But it became so viral that a lot of people stopped their medications and started drinking water. And that killing and stealing kidneys, this particular misinformation has really stopped cadaver transplantation in our state for quite some time now. It was running along very nicely, but for 3-4 years back, we had a cinema which came out, which showed somebody being, kind of killed in an ICU and the organs harvested. Following which, a lot of misinformation surfaced, and this led to people being resistant to donating their bodies of their kin who are brain dead. Of course, there were some issues there, there were some protocol problems when a brain death was declared in one patient, which led to some litigation and all. But this was so much blown out of proportion that so many people suffered due to lack of organs being harvested from brain dead patients. And all the thing about vaccination and how it decreases fertility. So misinformation is very bad. let us go to some interesting things, misinformation, which and the shape of the beast actually. This is a 2016 tweet and a fake news which got around 10 million shares. Pope Francis shocks the world, endorses Donald Trump for president. This is in America, 2016. Of course, I will not be talking about India in a political context at any point in the presentation, because that is not required. For illustrative purposes, we can go to US. This was a tweet which was believed widely and quite fake, and it was just prior to the our election during that time, 2016 American election. And another one, WikiLeaks confirms Hillary sold weapons to ISIS. Okay, this is from the so-called, right-wing in politician, right-wing politicians. But you would think that it would only come from right-wingers. You are wrong. Ireland is now officially accepting Trump refugees from America. So that Trump, it seems that the Trump administration is so bad that Americans are trying to immigrate, and Ireland is accepting, political refugees from America. This is probably from the so-called American level. Again, from Sri Lanka, a WhatsApp forward saying that 23,000 medicines have been procured or seized, which will cause infertility, which has been seized from the pharmacy owned by one particular community person. Okay, this quickly became viral, and then people were threatening them with, lot of threatening messages appeared subsequently. And a huge riot broke out, which killed at least one person in that particular riot. This keeps happening all over the world. And actually, you can see another one. This is from India. A very respected person said that if anyone who can hold breath for 1 minute, it means that the person is not suffering from the novel coronavirus. That's what he said. And then he said that you can put that mustard oil through the nose and the corona will flow into the stomach and die in acid. This is reported by a very credible newspaper. So it could be true, it may not be true. But these can happen, in 2021, an Alberta study found that social media is the biggest producer of misinformation, 85% of it. And internet sources make up 91% of all COVID fake news. Among countries, this is surprising thing. India is the biggest source. Of course, Russia and China are out of the gambit. China, you cannot know what is happening. And all the social media and the internet is under control of the government. So obviously, we need to. And India has got the largest number of people using internet other than the other countries. So even then, it would come as a surprise that India is the biggest source, in the sense 18% comes from India. This is an THIP study, a Healthy Indian Project 2024 study, which said that 3 out of 5 Indians, this is actually a voluntary organization, who are debunkers of fake news, a fact-checking site. 3 out of 5 Indians are vulnerable to health misinformation. 62% knew nothing about how to access authentic information from the net. And 36% were concerned with alternative medicine. And we have a low trust in doctors. 49% only will follow doctors' orders when faced with misinformation or the doctor's information. This is how approximate truths are born in science. I just thought that I'd put it because you know what? There are first systematic observations, then it has to be naturalist. You cannot bring in supernatural causes in there. Of course, I'm not saying that may not exist, but usually in the scientific method, you just think about naturalistic causes first. And it's a marriage of empiricism, that is real world findings, and logic. Logic is a scientific logic, you see. So suppose we think that, so in the beginning, we may think that, okay, it may be a clinical observation that cigarettes cause people, heavy smokers may have lung cancer. But then we do observational studies and confirm that that is correct. And then we do try to do cohort. First, it may be a case control study. Then we try to do a cohort study and try to find out whether the correlation is strong. And the concept of correlation. So when there is a correlation, it doesn't imply causation. But then you have Hill's criteria. How much is the effect size? Do repeated studies show the same thing? Is there a logical way to connect? Is there a cellular way to connect or a physiological way to connect it? That is the does the present logic allow that truth? That is one thing. So you have a Hill's criteria to have an approximate thing. There, it should be falsifiable. It should have predictions. There should be a peer review. A lot of experts should agree on it. It is not a democratic process at all. It's a consensus of experts. And Thomas Kuhn, one philosopher of science, has said that it is basically like a belief system. Okay, this may influence you in a bad way because you may, it would seem like I am saying that scientific consensus is a belief system, but it is sort of, yes, it is a belief system, a consensus among experts. But there can be different camps. Some people may think something, there may be fringe groups. Why I am saying is that you cannot, when you try to debunk misinformation, you cannot really just be paternalistic and tell them, okay, this is like that. You have to really educate them about the scientific method and why we say what is correct and what is not correct. And there are nuances, and we need to say these nuances. Otherwise, people think that we are just authoritatively and non-democratically saying things or imposing things. This is a peculiar mindset of people. That is to say that there is no 100% proof in science, even in the physical sciences. There is only a preponderance. That is the first thing that you need to understand. There can be controversial areas that we need to communicate. It's a historical process. But if we can explain, predict, and control to something, then that is a good working theory or a hypothesis, and we go about that. But we have to understand, and whenever we say, you stress on the fact that it's a far better than any other way of gaining knowledge. By explain, predict, and control, you say the concept of depression or depressive illness. It may be vague to some people. How do you measure it? The way we measure it may be vague. It may be a questionnaire. But we need to tell them that it explains certain things. It explains how people commit suicide, and it explains how depression happens. There are correlations in the brain or some fMRI findings. We are able to predict suicides based on these questionnaires. We are able to do randomized control of drugs based on this. And we are able to control this disease to an extent, and we can base it on real data. But there are problems. You are not researching your conspiracy theories. You are conclusion shopping your insane hypothesis. This is the way our mind works. This is called confirmation bias. We need to be careful that most of us are humble. We should be humble. Even though we are doctors and we have expert knowledge, we may fumble in health, even in health information. Not to say the other type of misinformation for above and for which we are all prone to that kind of misinformation. Humans are error prone. We are cognitive misers. That means we do not want to think. We just want to see and believe. And most of the time we are not thinking much. That's the truth. So we are cognitive misers. There is something called affect primacy. We are emotional creatures, and we base most of our decisions and we come to conclusions based on the positive emotions or negative emotions we have. And we are very much concerned with or affected by negative information. Actually, negative information attracts us because we want to know more and more about what this negative information is. Anxiety provoking and fear provoking information catches our attention, for which all the social media actually competes for our attention. So that is something which we have to be aware. And another thing is that most of us make our decisions based on group loyalty. So if most of us are, if one of us is part of a WhatsApp group which believes in traditional medicine or very that kind of thing, or an anti-modern medicine stance, then it's very difficult to have a different opinion, and rational arguments may not cut much ice. This is called motivated reason. This is a source of misinformation. Actually, most of the misinformation out there is not made intentionally. It is being shared by people who believe it, who make it up inadvertently, who may actually think that is correct, and then they share it. So this is mostly because of motivated reason. You are coming to a conclusion because of your emotion, and then you are doing that. Now, misinformation is not. Even from the time of Hermann Gunder, or kind of from the time of the printing press, misinformation has been there. But what has caused this explosion of misinformation in the present era is because of disintermediation. The intermediates are gone. The official agencies, usually we get our used to get our health information or official information from the news networks, from the newspapers, where journalists, whatever you say about journalists, they were trained to curate information, check for accuracy, and then deliver it. Okay. And people used to, even journalists used to look down on these papers who didn't check their facts. But that is slowly going. The power of official agencies like WHO or ICMR, okay, we are putting out bulletins. People are not looking at it. People can directly go. And I have personal friends, doctor friends, who say that they do not look at the news. They get all their information from Twitter, all their news from Facebook. And they're oblivious of the fact that they may be part of a silo or an echo chamber where they may be listening to only people who are deluded like themselves. And now there is an information glut, the internet era, then the smartphone revolution, social media, and the total breakdown of gatekeepers. And our children are being brought up in this environment. And a famous cyber psychologist have called it the largest uncontrolled social experiment in history. You know what? Misinformation is much more attractive, and it is shown to circulate around 7 to 10 times more than accurate information. It's also, misinformation is emotionally engaging because we are competing. Even social media is competing for our attention. Fearful or anxiety-provoking things will be shared more. They know, so that kind of content will be put out. Often provides immediate, simple solutions. Have diabetes. You just take some this or that, and you don't have to do anything else. Many a time it is outrageous, or it generates outrage. It tries to generate outrage. There is a famous book called Outrage Machine about social media. Actually, it's an outrage machine. Most of us try to, whenever we put a post, we know that we will get more engagement if it generates some outrage. That doctor has screwed up. One person has died. This is just because of this. So immediately it generates an outrage, and attention, people can grab their attention. And this is how social media works. And it is usually moralistic. You should do this. You should not have done that. What have you done? Like that. These are the kind of things which get shared easily, and facts get told. It is pleasing and reinforces your biases. Media may err, especially in this area, is in this era. See, previous era also, uh, it used to be like that, but you had these gatekeepers and all that. But still, media in the earlier also, it used to be sensationalistic, generate some outrage, attention-grabbing headlines. Whenever they report some scientific thing, this scientist said that. Totally, cholesterol is not responsible for atherosclerosis. Even if you have cholesterol, some scientists have said that it will not cause atherosclerosis. So it may cherry pick fringe experts and say this. But it may not give you much nuance. But now what has happened is that it is scared and it is insecure because the mainstream media has become much more vulnerable. Many media houses are closing down and they are like, they do not know how to survey. They are mimicking this social media. Actually, this misinformation, there are people who put out misinformation deliberately. So some people call it disinformation, but practically they are the same. So the same thing which Goebbels said years back in 1940s, big lie. You can say two outrageous and very outrageous lies, but you have to keep repeating that lie, which will cause an illusory truth effect. Okay, you are in one WhatsApp group, so you get one forward. Okay, you get another forward from somebody you like. From another group, you get another forward. Then you have a tendency to think, oh my God, this is likely to be. Second, another thing is that half truths will be there. So some physiological aspect will be quoted. Some animal study will be quoted. And then you mix it with bad information. These are all very, very well-known points. There might be bogus authorities, like NASA. NASA has said that. NIH has said that. All that kind of thing. Fringe authorities may be called. There may be actually, he or she may be a scientist or an authority or a very respected doctor, but he may have a fringe idea. So that may be promoted. There may be spiritual concepts. Spiritual concepts may be good for us, but it has got a certain sacredness which cannot be questioned, and that can be used by peddlers of misinformation. Appeal to sacredness, appeal to ancestry, appeal to emotion. Now, a word about orthodoxy. I know it is orthodoxy. Actually, I like Ayurveda, and we are one of the societies and one of the countries which had a real good medicine in 300 BC. We know that Susruta was doing surgery and plastic surgery in 300 BC, which was far, far ahead of anywhere in the world. But how do we approach it now at the era of modernity? How do we integrate it? Should we integrate it? If we integrate it, how do we make it evidence-based? Now, what is happening is that there are Ayurvedic practitioners coming, there are homeopathic practitioners coming. All of them are practicing or working under medical professions, modern medicine professions, and they want to practice modern medicine. And this is being slowly promoted officially, but nobody knows how to handle this. Everybody knows this is not correct, but how to integrate it, how to do it rationally is impossible. You have this outrageous advertisement. Just see that. Allopathic medicines can harm. This kind of advertisement was flagged recently by the Supreme Court, but it's not a real solution. This will crop up again and again. I'm telling you, and I don't know whether any solution will come forth or whether this will continue. There are certain studies which say that you would think that old people are wise, and they may be more discerning in identifying misinformation. But it has consistently been shown that people over 65 are very bad at identifying misinformation. And as you go up in your age, you become more and more worse. You will become worse at identifying misinformation. You forward unnecessary things. Why would that be? Is it because they are less intelligent? No. I would think that this is a cohort. You see, we have it. Even I have it. I was an adult, by the way, properly practicing my trade when all this smartphone revolution happened. And then we have less experience. But children now and youngsters now have more experience in social media, and they know how it distorts the fact. So I think this fact is a good thing. This fact is a hopeful measure that shows that people slowly starts to develop that discernment. There are people who say that places like India are worse in discerning misinformation and being susceptible to misinformation, because most of our population is slowly becoming literate, and they are becoming discerning only now. And suddenly they were thrust into the smartphone revolution. Maybe that is why. That means that we may become better off. That is a problem. Now there is an artificial intelligence threat, which may completely, it may completely revolutionize the way we think about most things. And it may be very bad with our problem with misinformation actually might become worse with this. I'm not going into the details. Maybe we can have a discussion later. This is the info clinic information, which organization which I'm part of. It is basically a FB page based in Kerala, putting out debunking misinformation and giving correct information, mostly in Malayalam. A few years back, I had given a TEDx talk regarding misinformation, how to tackle that. I'm not going into the details of this. Already we have touched about this. Maybe I'll just go through the theory part and then go into the discussion, because none of us can focus our faculties for that long. That is what I think. Now, when we debug, there is a risk of entrenchment. When you engage a misinformation or somebody peddling misinformation, he may be actually deluded or he may be mistaken, but you just talk to them. Okay, no, you are wrong. This is the correct information. Immediately, people become more entrenched in their beliefs. This is a big problem in combating misinformation. There is something called pre-bunking, which there are even randomized control trials in pre-bunking on Twitter, and in that you anticipate misinformation. So if you are a doctor and then you are writing a little bit about health, or you are talking to patients or other people, and you just give them small. It's like a vaccine. You just give them a small doses of how medicine works. See, it's not magic. It has got certain evidence based how it works. Why I say that cigarette smoking causes cancer? Why cholesterol is bad? Eating there is a certain nuance which has come, which says that you can eat a little bit of cholesterol now. That's okay. But still, lot of oil and saturated fat is still bad. And we are talking about blood values of cholesterol and lipids. You keep talking to them in small doses, continuous correct exposure, and try to improve critical thinking. It's very difficult to do. It has to be sustained, it has to be continuous, it has to be steady. But this has been shown to have some effect. This is what most of us say. So leave alone other people. Everybody, most people are stick to their beliefs. My mind cannot be changed. This is what most people are saying. So you have to be aware of that. When you want to deepen, you try to understand why that person is saying. So you ask, why are you saying this? He may have had a bad experience from a doctor. He may have had a bad experience. He heard about some bad experience from one of his friends. Many such things may be there. Then you tell them, see, this you are generalizing, or I sympathize with. But you see, I have another experience. This is a painstaking process. It's not easy. When you have deeply held beliefs, you may be like, you're a terrible person. You're caused this death, or this is how you behave. Like that is not conducive to changing a person's mind. It's impossible to change a person's mind in this. That is the thing. I mean, if he's misinformed, of course, if he's deliberately spreading misinformation, that's another thing. But when you're deliberately spreading misinformation, what can you do? You can have oversight, okay, but it's sometimes a double-edged sword. And the problem here is that this Twitter or Facebook, everything works on this advertisement mode. So they want to promote what spreads. They are not bothered about the truthiness of what is happening. This is the biggest problem with it. But you have to understand that even a messaging platform like WhatsApp has these faults. It's also generating outrage. It also generates emotional content. It also generates that kind of thing because of our biases, psychological biases. But things like Twitter and FB and other, even YouTube, would be doing that to generate advertisement and not truth. But the platforms need to, kind of step up. We need to have verified. This is what some people are saying. We need to have 100% verified users. We need to know who is doing what. But it's a double-edged sword because the authorities can selectively suppress that. They can selectively encourage. So in China, all the internet is owned by the government. All the social media is owned by the government. Similarly, that happens in Russia and many other countries. So in such countries, an authoritarian governmental official oversight doesn't actually work. It makes lead to another type of misinformation. That is the main. But mostly, I am sure you agree, and I also agree. We need some type of oversight. When we deal with patients, I feel that we should understand that patients there's no point in becoming angry with them. They face tough choices. So many people will be talking to them. So much misinformation will be coming to them. They need your time. But in India, what is happening? You are forced to look at 100 patients in a day, 200 patients a day, 300 patients a day. How are we able to? This is the kind of thing we should be able to tell people or tell the government. We need 10 minutes to speak. We have to have. So you employ more doctors in the government. Otherwise, we cannot. When we have a patient coming and they suddenly say that I am going for Ayurveda, and you think that now them going for another type of treatment will be very bad for them. How do we tackle it? It is, I don't know. I always tell them, okay, if you want, you just go. And then, for example, just to tell one example, I had a patient who had a large diabetic ulcer. He was quite an old man, and the sons were taking very good care of him. They wanted the best for him. But it was coming to a point where mostly he will need an amputation. So he was not in sepsis, but the leg was bad. So we talked to them that amputation is there. And suddenly these sons came to me and they said, sir, so many people are saying that there's an Ayurvedic doctor. Actually, he's not an Ayurvedic doctor. He was. Most of the people who they are saying Ayurvedic doctors are not qualified Ayurvedic. That is another. So this person will cure. But now many people would become angry and talk to them. This is a wrong approach. So I told them, see, you do one thing. You take him there. But insist that the sugar has to be more. If the sugar comes down, you stay there and do whatever he says. But you can come back at any moment. You can come back. Please come back whenever you are unsatisfied. They took him there. Within 2-3 days, they brought him, saying that his sugars were not under control. He was getting worse. He came back and we did an amputation. He happily went off without any issue. And this is what happens. We can have a discussion on that. And when you are a doctor and you're trying to do promote some health information through your social media handles or when you're writing, don't engage with mad or deluded. You ignore them or hide their thoughts. But when the WhatsApp forwards, when you are a member of a group and very damaging misinformation, I think you should respect, saying this is not correct. This is an incorrect information which will harm you. Don't engage more than that. Shows other people that, okay, there is some problem with this media. So that is, don't be confrontational, but we should not be condescending or patronizing. That's very difficult for most of us in the Indian environment. But it is worthwhile trying to avoid that. When fighting monsters, you do not become a monster yourself. That is one thing which you should. So if I want to kind of condense my presentation, I would say I have tried to give you an idea of what misinformation actually is, what health misinformation means, and how difficult it actually is in our present social media set. And it's a big problem all over the world. Why it is a big problem? And fighting it is not a solved issue. So we should have a discussion on that. What I have done is a very minimal kind of thing. Maybe we can do that. Maybe we can do this. Maybe we do that. That's the only way we can approach it till now. And so I think we can have a discussion on it. So I have finished with my presentation. Maybe we should have a discussion.
Thank you, Jimmy. Dr. Shivaram and Dr. Sridhar, if you could come in.
Yeah, it was a very nice, interesting talk. As usual, Jimmy, I think you have put it very succinctly. Very nice. I would like to add a few things, if I may do so. One is our own people giving disinformation. I fully agree with the other system people giving alternate medicine or other thing. And then there is another odd thing called as the random stuff, which I see it very often. If you get a urinary tract retention, you take citralca and start jumping up and down, and then you will pass urine. This is another one which has been circulating like mad in WhatsApp. I don't know how many people landed up with a rupture of the bladder, with a full bladder like that. And I normally find they add a few things like, it is a senior ENT surgeon, he told, an ENT surgeon jumping up about prostate and then saying the retention will become all right. And another general practitioner from South Africa swallowing a whole lemon with a ginger and says that COVID becomes all right. They're all allopaths. how to do with these guys. That is something I think we will have to be a little bit more careful than the random guys. Just now I saw one video saying that if you are constipated for more than 7 days, that is an early sign of you getting paraplegia. And another person says, you swallow your pepper, keep it behind the third molar and then bite. Then your paralysis will immediately vanish. So if you are giving a CVA, go for a pepper. So these are at least something which we can contradict. But our own people talking about, you can understand. So there are 3 different types of disinformation, I feel. One is a really false one. Other one is an inaccurate one. And the third one is a misleading one. I think these 3 are definitely differentiated to be differentiated when we are defending. I don't know. I have made a cut, copy, paste few paragraphs because we are getting this repeatedly. So I copy that and paste it in every WhatsApp group in which this misinformation keeps coming. I don't know more than that. Unless they ask you, I don't know how to fight this. I need Shivaram.
Yes, sir. I'm here. Yeah. Yes, sir. Lovely, Jimmy. That was really succinct. It is almost as if, when I was trying to get some read up on the whole thing, you're almost like taking all the words out of my mouth and you're actually condensing what I was saying. If I might be allowed with a few comments. Starting with the initial thing, Jimmy was spot on when he differentiated between misinformation and disinformation. Although they're very similar, I would like to make a small distinction. Misinformation is incorrect. Both of them are incorrect. But when the person sharing it doesn't know it's incorrect, when the person sharing it knows it's incorrect, but still shares, anyway shares, that is misinformation. That is one point. The second point I will make is, how does it spread? As Dr. Sridhar was saying, outrageous statements are very easily countered. It is the ones that sound very authentic that are more difficult. Yeah, plausible, that sow doubts in people's minds. For example, I don't know how many people remember there was this study by one Wakefield debunking the MMR vaccine and linking it to autism. Now, this is not just outrage. It created enormous damage in the world, enormous damage. Thousands of deaths because people refused to take the vaccine until there came a time when the whole study was debunked because they falsified data. He misrepresented everything and he did everything wrong. And Lancet, PMJ, everybody got out of that by retracting the article. Now, that is a very difficult thing. The third point I was making was when, as you correctly said, social media amplifies and explodes information in a way that we are not used to for the last several hundred years. In addition to that, the addition of an angry language, actually they found that somebody did a very detailed study of misinformation. When somebody adds an angry tone to it, it has this fantastic way of spreading as opposed to somebody who's doing it very passively, very softly. When you're outraged and spread that outrage in the internet, it travels very, very fast. So what do we do about it? My second point is, okay, we all have enormous number of explanations about the whole thing. So what do we do about it? What I tell my friends, my patients, whenever such things happen, this is what I tell people. What do you do? And you're quite right about the echo chamber. People like to have their confirmation bias and have their own echo chamber. So when in my circles, in reasonable circles, when people ask, How can I verify? Yours is science, this is also science. I tell them, be a critical thinker. You check the source. If that person has previously been known to be reliable, then the information will be based on what Jimy correctly pointed out as old school journalism. Typical old school journalism style reporting, fact checking, backed by data, backed by science, and reliable sources. If you find that, maybe there's a. Secondly, check the dates of the information. As you all know, when COVID started, I remember a lot of the groups, they said, oh, place an onion, half-cut onion on your doorstep. If it becomes black, all the virus will get into that and it will just disappear. I wanted to check out how this happened. So I found out it was a plague remedy of the 14th, 15th centuries. 900 years outdated information, somebody managed to put it, and people are spreading it far and wide. Then the last thing I tell them is step back, step back. Spend a few minutes, 5-10 minutes fact checking. If you cannot verify the information, please, the least you can do is do not share it. Don't share it. If you're unsure about it, do not share it. That's what I tell them. As he correctly said, don't be antagonistic. Don't be rude and tell them, I know better than you. I'm the expert here. Therefore, I'm correct. Not like that. Please go through all these. If it doesn't sound good, if it doesn't sound believable, it is probably not believable. And the last thing I tell them is if there's something very, very important, the last place you should look for is WhatsApp, perhaps. You will have mainstream journalism, mainstream media covering it in a far better, more robust way than the common source of misinformation like Facebook or Twitter. Thank you.
Thank you. I think we have got a lot of nice points from both of you. I would agree with this. As one point I did not really touch upon. I mean, I just touched upon, but it's our own people. You know, reliable people. That's why I said fringe. Some people will, you know, when a fringe authority comes, which was real authority, comes up and says nonsense, people are, I mean, just journalists just jump on that, you know.
Correct. And there are some Ganga Jal, like, you know, Abdul Kalam, NASA, Oxford, Cambridge, and Harvard, and sometimes IIT. They are all Ganga Jal. Any lie, any false information, if you add any of these names, then they become indisputable.
Totally. And also, if it is sensationalist, right? Anything, reality is actually boring. You tell somebody this doesn't work, it's actually boring. When you sensationalize something, you get the attention that you get and the engagement that you get in people is incredible. When you sensationalize a piece of news.
Nice.
I have personally used in my this thing, you know, I try to be slightly, when we are debunking that information, then to get that information across, I try to use some catchy headlines myself, you know, to promote that, or, you know, kind of use some disparaging humor, make it more interesting. And these are all some things which we can try.
Jimy, your initial slides are I think that's very, very important, the way you outline the methodology of science, because people are often tell you, oh, that is your science, this is my science. There is no such thing as your science or my science. The methodology that you're telling is actually universal. That is also
it's a huge topic, maybe, but it requires another talk, actually.
Maybe, Vidya, you must have a topic of what is science.
Sure, sir. Ravi, you have your hand up, Ravi Shankar.
Yeah, sorry. My pet peeve is medical misinformation from physicians, and that's of two types. You know, there's the one type which you just talked about. The other type that really gets my goat is the ones where they make it so pseudoscientific. It's about 80% scientific, 20% is where the truth actually lies, which is what they're not talking about. So they take studies and they selectively present data and everything. And I might be making a very controversial statement, but someone like Dr. Hegde, for instance, those YouTube videos and those things are awful. And at the same thing, there was this thing by the American Diabetes Association that you don't need to treat people with an A1C of 7, and if they are elderly, it can even be higher. So immediately there was a YouTube video from a physician in India who had said that the diagnostic criteria for type 2 diabetes have changed. Somebody who had no idea of the difference between the threshold for diagnosis, which has remained an A1C of 6.5 or greater, and a target for treatment. So, simple things like this, and they create so much confusion. And when you try to say things, I mean, even with family members, your credibility suffers because they believe somebody with a YouTube channel than somebody who's actually looked at all the data fully. So that is something that has to be taken up very seriously. And it's charlatans, as it's a totally different story. But when people with an MBBS degree actually do that, that takes on a significance that's entirely different.
Yeah,
Yes.
correct, Ravi.
Yes.
That's exactly I meant by saying that our own people, when they talk like this, the person whom you mentioned was my teacher. That's why I didn't want to make the name. But it's really like that. It's really sad. So they are more reliable now. I think they convey that with an authority rather than.
Manjunath, you have your hand up. Manjunatha.
Yes, ma'am. I just wanted to make one quick point, ma'am, that because of this misinformation or disinformation, whatever it is, some people who are actually doing good service in alternative medicines also get affected because of the so-called quacks who are actually ill-trained or not at all trained. That was my point.
Yeah. So alternate medicine is a different and difficult topic altogether in the Indian context. Of course, it's a source of misinformation, but that's, I think, a different and difficult topic. It will not be solved.
Actually, a lot of people misunderstood this as, modern medicine versus other medicine. It's not that at all. I mean, that may be part of the story, but today's focus was on general misinformation about health. It could be about what causes disease or what is used for prevention of disease, what surgery to have or not have, anything and everything. Because like Jimmy, I didn't know about this statistic about that people above 65. When I'm myself going to get into that in a few years. But I found it very odd, like you said, that most of my older relatives are all very busy. I mean, they absolutely believe.
Yes,
like,
they believe.
It's like
That's true.
about anything, not only health, about anything.
Yeah, everything.
Yes.
Correct.
What we joke as WhatsApp universities actually become that. So
Totally.
it's quite unbelievable that how people whom you knew all your life, who are very intelligent, rational people, how are they doing this? And now your talk has kind of made me understand a little about how this is happening. Dr. Venkatesh Natarajan, you have a lot of posts on the chat. Would you like to say something?
Yes, ma'am. Jimmy Mathew, sir, excellent talk again. Beautiful compilation of very important. I mean, the vocabulary. We need to get this vocabulary. This vocabulary is more important, I felt. And regarding misinformation, being a nephrologist, we keep seeing kidney failure patients coming because of misinformation which they obtain from multiple sources. And as usual, the greatest culprit has always been social media. You won't believe, we have actually published a series of membranous nephropathy on well-educated professors who are academicians who bought stuff over the internet and were using it for general health benefits. Now, all these people have developed severe membranous nephropathy, and this was published as a case series. And this is one just example of how miserable it can get. The source of misinformation is generally an appeal to emotion, and in desperate circumstances, people want to try desperate stuff, and so many other factors. And it is so commingled or intermingled with other social and political stuff that it becomes exceedingly difficult. As doctors, how we are going to fight this misinformation is going to be very, very confusing. And your tips regarding how to actually have this conversation with somebody who's got who has ideas which he has gotten off from inappropriate sources, especially a non-confrontational, non-patronizing, a Socratic method of approach to this whole problem, is probably the one good point that we have to take home. The other thing is the Dunning-Kruger effect. The people who are so-called experts are no longer considered experts because they keep quiet because they know that they know little. But it is those who are less informed who are the ones who jump on, and create a bandwagon fallacy where everybody is on board and an appeal to authority. And, it gets entrenched so much so that it's very difficult to break this cycle. And as physicians, one of the things that we need to do is we need to be more vocal and start, each one of us start campaigning by writing more frequently in mainstream media or in whatever small ways that we are supposed to do. That perhaps is probably the only solution that we can see.
Yeah, actually, that's what we had a chat on social responsibility of doctors recently, where Dr. Arvind talked about what all is damaging our lungs, how to improve the environment. So it just struck me that this is also probably one of our social responsibilities that, like Jimy says, if nothing else, if we engage for an extra 5 minutes with every patient, a little more than what is barely required, and address. I liked your thing called like vaccination, so just small doses of for correct information. Of course, we have to get our facts correct also. We ourselves may be victims of bias or misinformation. So if we could, maybe in Hindi you say, no, boond boond se ghat bhare, like that. Small drops might make the ocean. So yeah, your point is well taken. Many of us may not be good writers like Jimy or Sridhar sir or Shivaram. Yes, Dr. Shivaram.
So it didn't mean to interrupt you, Vijay. Carry on. I just wanted to just add one small comment to that. Please finish it.
No, I'm good. I'm just.
Yeah.
Yeah.
Now, that info clinic, what you were mentioning, Jimy has actually made a start there to that something like that info clinic. You have your own platform where you put, instead of just telling somebody you're wrong, that's a bit like as Jimy said, don't take a patronizing attitude. Provide platforms, credible sources, relevant information, relevant authority, and give a little bit of space for the other person also to be wrong. And that's okay. Can I just quote one funny thing? This is not new. This, the kind of conversation we're having today has been there for ages. In one of the old Ayurvedic texts, it says, if I might be allowed the liberty, it says, Yasya kasya taror moolam, yena kenabi garshitam, yasmai kasmai pradadavyam, yat va tat va bhavishyati. What it says is, you take this root or that root, you add it like, you crush it like that, you crush it like that. You give it to this person or you give it to that person. Something or something else will happen. That kind of humorous thing is there in Ayurveda. And it used to be part of graduation speeches by deans and big professors saying, listen, anything can be proved, okay? So you need proper kind of verification and information. So just saying this will happen, that will happen, doesn't cut ice anymore. That is what we have to tell people. And use their own language, their own methodology, their own thing to bring out the fallacy of what people say.
Yeah, I agree. One more thing, I talked about that methodology of science just to say one point. See, people come to me or come to, usually these people who are talking against evidence-based things, against science, immediately say, see, this one particular paper says that. That particular person said this. That is against that. Then what you talk to tell them is that, see, science is not a collection of unquestioned facts. It is just a preponderance of evidence shows this. So most experts agree on that. So this is the paradigm on which we base it. Then you ask them, what is the paradigm that you base it on? Tell me that. That works better.
Absolutely, Jimmy. I'm spot on.
Yeah, actually, when we do things like antibiotic stewardship and all, we come across this problem among our own colleagues. Oh,
Yes.
I've been doing this for 30 years, like,
Works for me,
my
works for me.
patient and
Works for
my
me.
patient, and I can't take a chance with my patient, or whatever it is. So, so we have to understand that we ourselves do it. So you can't expect the general population to be any better than us. Dr. Dejipia, would you like to say something?
Yeah, my connection is bad. I don't know whether you are hearing me well.
Very well.
Excellent talk indeed. Is my connection okay?
Very
Are
clear.
you hearing me?
Very clear.
Okay. Excellent talk indeed, and a good moderation by the two stalwarts there. Sometimes as allopathic doctors, we know very little about other forms of medicine, but it's a general trend that we are dismissive of those therapies as being harmful, not knowing enough of them. Are we sometimes wittingly spreading disinformation? What is your take on it?
I mean, I think we are definitely many of us, as Dr. Sridhar said, many of us are spreading misinformation, and no doubt, many of us are fringe, and we spread our fringe beliefs, just like Dr. Hegde. But are we? That is a controversial question. From my perspective, let me tell you that medicine as such is an inadequately evidence-based. It is very complex, and we are trying to make it more and more evidence-based. Of course, making it more and more evidence-based makes it more and more accurate. We know that medicine is an error-prone thing. Unless we are vigilant, we will commit errors. The only way to avoid that is to be humane as well as be as evidence-based as possible. So when we look at it from that point of view, is homeopathy evidence-based? Is present-day Ayurveda as it is practiced evidence-based? I don't think so. So what the problem is that are they doing any harm? I don't know. So many patients ask me, can I take Ayurveda medicine? So I always tell them, along with this the treatment that we are having, you are having from us, from modern medicine doctors. We know only this. This is the treatment we know. If you go to an Ayurveda doctor and want to take, especially when the problem is a terminal one, or terminal cancers or things like that, I tell them, you are free to go to an authentic practitioner and then take their medicines. I have no problem with that. But if there is some problem, we need to see you also, and you definitely have to. But that's the only way we can tell it. You see, there's no point in telling, no, only we are correct. I think that is a bad way of telling it. I mean, they may even, leave us. Even they may not take our treatment and then go to that person. So I feel that is a lesser evil. But are they evidence-based? I don't know. This is probably not the way to go about it, what we are doing now. We have to either, if I'm sure, see, it's a proven thing that a lot of Ayurvedic medicines and herbal remedies have got active ingredients. Now, what are these active ingredients? What are their doses? What are their side effects? So it is a misconception that Ayurvedic diseases will not, or Ayurvedic medicines will not have side effects. If there are any effects, there will definitely be side effects, which we know from our experience with modern medicines. Our modern medicine also started with herbal, mineral remedies, just like Ayurveda. So how to go about it, I have no idea. So just because we don't know doesn't make it, that they have something which we don't have. They may have something which we don't have. And I'm not sure. If they have something which we don't have, we need to prove it. We need more evidence based. That's my take.
No, but
Yeah.
the
Thank you.
current narrative is that it's been there for 300 years, so you don't have to go prove it now. I mean, this is from educated people who are other with scientific bent of mind. Who, this is the way they speak. That why do you need proof when something's been around for 300 years? So how do you address that?
Vidya, can I just say, if
Yes,
you are
sir.
scientific and you want to try it without what is considered proof, go ahead, be my guest. So sorry, I wanted to say something to Jimy before I forget. So Jimy, I would not classify Dr. Hegde as fringe. Classifying him as fringe and dismissing it as fringe belief is actually more dangerous. He is not fringe. He is selectively presenting data. He's read the whole thing. He's only taking stuff that will, sort of will prove his point of view, and he's just an example. I don't have anything specific against him. I'm just using him as an example. Yeah, and when you talk about misinformation, I think I wrote that in the chat box to Dedipya. You need to know what information is to correct that misinformation. So when we're talking about Ayurvedic medicine and all of those alternative medicines, it doesn't have to be just Ayurvedic medicine. It's also this Kampo from Japan or traditional Chinese medicine, etc. What we don't know is exactly what you said. We don't know what the active ingredients are. We don't know what the side effects are. We don't know any of those things. So we don't know what information is to correct misinformation. So whatever we say should only be that, hey, we don't know enough about it. So I don't want to give you an opinion one way or the other. And very importantly, science, like you mentioned, scientific dogma is an oxymoron. There is no dogma in science. Everything has to be proved. Things that we think are proved today can be different tomorrow. So unless you're going to be open-minded, you cannot be a physician and certainly not a scientist.
Yeah, very true. Didipya here again. I just tell them that I don't know enough of those drugs to help them make an opinion. I ask them to co-consult their allopathic doctors. I mean, their alternative doctors and decide for themselves because I don't know enough. That's how I take it.
Yeah, thanks, Dedipya. Venkatesh, you have your hand up again. Did you want to say something?
Yeah. Yes, ma'am. One of the problems which I face is when a patient requests whether they can take a certain pill or a certain type of medicine with which I am not familiar with. But when I'm not familiar with, I also have a duty that I should protect them from further harm. They have their values and preferences. I should be able to present information in such a way that just because I do not know, the responsibility or the onus to find out whether what you are taking is going to be right or wrong, it rests on you. Probably that means I'm not completely keeping the best interest of the patient in my mind. So that poses a lot of ethical dilemma. Is it not our responsibility to protect them from further harm from themselves? Is that not one of the important aspects of the healing hearts? Then it becomes an important issue. So trying to present evidence or what is evidence or what is the truth or what is a true estimate of truth and trying to make people understand in a short time span, especially when the rapport with patients are not very great, at least in the first few consultations, it's a really big challenge. So I think misinformation can be combated only by taking up responsibilities to actively bust myths. And that is a responsibility for every doctor.
Thank you, Venkatesh. Dr. Sridhar, would you like to respond to any of the comments that were made?
Yeah, I think I have a similar experience. I had a patient who is known to me, a temple priest, who came to me with a less than 1 centimeter lesion in the cheek inside. I did a biopsy, and the biopsy said it's a squamous cell carcinoma, stage 1. I could have done a wide excision. Possibly I could have even primarily closed it at a small flap. His father came and told me, no, I'm going for an alternate medicine. I know you guys, you will just cut off the whole cheek and everything will leave a big hole. I said, I will reconstruct it, no problem. He said, nothing doing, and he went off. It was a very simple procedure. He went back. Had he gone to, as Jimy said, to a proper Ayurvedic physician, qualified, he might have told that I have nothing to offer. But he landed up with an Ayurvedic quack. So there are also many quacks are there, especially for cancer. And he started on treatment. And then they did a CT scan for that. And he said growth has become small. Then he came and showed me the CT scan. I said, look, it looks the same. If not, it has become bigger. Then he never believed me. He went back again. He came to me back with a big retromolar growth, inoperable almost. And then we have to go and remove entire cheek. Went retromolar, went up to the skull base, removed the whole thing, and we have to go for a large flap. And again, the father came back and told me, see, look what you have done. I should have continued with the other treatment. So I had to convince them. And ultimately, of course, she died with a lot of secondaries within about a year's time. Had he been sticking to us with a 1 centimeter, less than 1 centimeter growth, after the biopsy, almost there was no lesion. I know where it was. So I said, tomorrow we will remove it. I said, I will do it free for you, because he was a temple priest, he can't afford. But still he did. As rightly pointed out by Jimy, I think even in Ayurveda there are quacks. Especially for cancer, there are many who just give some kashayam, something, and then go. And then there is a fish treatment. I don't know how many of you know for asthma in Hyderabad. There is a big queue. You have to open your mouth, close your nose, and then they will put a small fish, and then they will close your mouth, you swallow it. Then asthma goes. I know many medical people, doctors who have asthma have gone.
Live fish.
Yeah. This is neither Ayurveda, nor homeopathy, nor allopathy. I don't know what pati is that. I think it is a
fish pati.
What pati you can call this as? I think quackopathy. So I don't think we have an answer for that.
Vasmati, would you like to say something? You have quickly given a link for all the recent articles on health misinformation.
Yeah,
Thank you so much for that.
Thank
you so much.
The good number, so I limited it to the most recent. But Dr. Jimy, I loved what you said about the old person and that sugar and how you advise them. It reminds me of a friend of mine who had breast cancer, and she went to Tata Memorial in Bombay. And she just asked the senior physician that, should I try alternative? And he said, you know, it's a little late now, a little earlier, I would have said, okay, you want to try, you try. Then she said, could I have it along with this? He said, go ahead, no problem. Then she said, how will I know what worked? So he said, I'm ready to give full credit to that as long as you're doing both, and I'm sure that I'm making you safe. I told her that you couldn't have got somebody better than this. And I really love
Great
that.
one.
I just got reminded of that
Yeah, I
point.
agree. Another
Correct.
doctor also has put it in the chat that we cannot do more than you cannot save everybody. We cannot save them
Correct.
from themselves. We
That's
just
right.
do whatever we can and then
Yeah.
be
No,
professional.
and for many of you who don't know me, I'm not a doctor. I'm a former medical librarian. I have myself gone through this kind of thing. For example, once I had a ovarian cysts, and when it was diagnosed, I otherwise was on homeopathy for allergic colds, and I had had a myomectomy earlier for a
Fibroid.
extrauterine. And my homeopath told me that, I could have helped you save that as well. So when these cysts were diagnosed, I told the radiologist, I had just quit the hospital at that time. And I said that, how bad is it? Can I try homeopathy first? So they said exactly what some of you said, that, we don't know anything about it. We can't tell you. I said, I don't expect you to know. I only want to use the best of information on both sides. If it is urgent that I need to have surgery for this, I'll straight go ahead. But if there is time, I'd like to try that out. So they said, no, nothing is urgent like that. And I said, I promise to come back and keep checking, through ultrasound and all that. It so happened that it got all right within 2 months. But I'm the kind of person who would be very careful about each, but not all health information consumers is the language we say today are like that. And I feel that today it is important that consumers are told that, okay, you want to try that, try. But as all of you said, that we don't know about that pathy or alternate thing. So you have to try it at your risk. You can't come back and say, you should have not allowed me to go there or something like that. Very complex, but probably that's the direction we need to
That's
take.
the right thing. Correct.
That is very common. Listen, if you had told me not to go, I wouldn't have gone. So
exactly.
that time suddenly paternalistic thing is required from the doctor.
It's a fear of taking responsibility. No, see, in the long back, we just completely trusted our doctors, and that was easy. Whichever doctor it was, whether it was Ayurveda or this. But today, we are, as a health consumer, I'm also confused, as somebody said in the chat, with too much of information around. But in the end, I go with who I know well and who I trust. And then I know that if I choose a different pathy for something, the other doctor is not responsible for that. I'm responsible for my decision. That is something, if other friends ask me, I tell them exactly that. Take responsibility for your decision, whatever you choose to do. And of course, I also agree about going to qualified, whatever. I go to a qualified homeopath or Ayurveda for certain things, and definitely check that out, not just anybody. That's true.
Yeah, thank you, Vasmati, for sharing your. Radhakrishna, would you like to come in?
Yeah, Jimmy, interesting talk and a very interesting discussion. Now, but a few things that go through my mind is actually, this sort of a misinformation has been there for a long, long time. If you take cinema, for instance, the mainstream media, when do they ever depict doctors and medicines properly? They have censor for everything, but there's no censor for medical things. There should be a medical board to say whether something is right or wrong. Now, mainstream television, there are channels which telecast sexology stuff in the middle of the night. And the so-called doctor gives advice looks like it doesn't look like a human being, and the very provocative person who's questioning is also the whole thing is very, very fishy, and the information given is all nonsense. If you get to see any of them, not just there's so many television channels, pay channels. As a matter of fact, they'll bring some Unani chap, will bring one lady who's crippled for a long, long time and got treatment and become all right. They all these things are not monitored. And television channel, again, There's no medical judge to say what is right or what is wrong. Why print media? You see, one of the famous newspapers come every number. Recently, it's come with the what is it that the fasting, the intermittent fasting is bad for health. Some unpublished Chinese publications there, and they'll just highlight it. Any decent population who read that believe is all true. See, there's no, again, print media, whatever goes wrong with medicine only is put up there. What is going right? There's no medical editor actually. There should be one doctor or some doctor group who are reading all this. These news are daily. If anything bad happens in one hospital, are in it, supposed to be bad, that's all promoted. Now, these social media things are come only now. And the channels, whether it's Facebook or YouTube or Instagram, the followers are millions actually for all these nonsensical quacks. A fellow will be, a retired bank peon, or, a fellow is owning a cycle shop, gives advice on everything, and millions of followers. See, and how to control this? What is our responsibility? Good that Supreme Court has intervened by IMA forcing Ramdev, to retract his words and, to come back, and now still they're not left him alone. I think that sort of a thing should come in. That sort of activism should come in. Now, when good that you started some channel and you're part of a group we are working on, but as Shivaram says, there should be many more channels that you and me should start. Many doctors should start, and not to promote themselves or their business. That's what we doctors do. We should promote or rather antagonize each of these myths and keep talking. If Bharadwaj comes every day with a new message saying, no, that is wrong, and this is the scientific proof. This AI in this social media, if you are only following that sort of a crooked news, only crooked news will come to you.
Yeah.
And AI also is not in our favor. If we keep presenting in these channels that, all those are myths and keep breaking the myths, only think AI will understand that we should follow. I think that bit of a thing which we should do in days to come. And actually, I have a plan from Sunday, which I told Vidya that I'm doing something of that nature. I'm going to talk about what's wrong with people's beliefs, and that nothing to do with promoting me or my profession. Wonderful talk indeed.
Thank you.
Yeah, thank you. Your closing comments, Dr. Shivaram.
Yeah, almost everybody kind of what they said was pretty in part of that. At the end of the day, we cannot stop people from saying whatever they're saying on any kind of medium. The talk was, as doctors, what can we do? As Jimy has started this info clinic, and part of that, and as Patta was saying, as much as we can form small platforms, whether they are a group of 10 people or 100 people, or LGS has got 10,000 followers, whatever scenario or ecosystem we fit in, is to periodically go to bust some myths. It could be something very simple. Somebody simply saying, listen, common cold is a common cold. It doesn't come by eating thyme. Or it could be somebody else saying, scar is a scar. It is not going to disappear by doing something else. Magic. Simple messages like that, understandable by layperson, backed by credible sources who are non-promotional. This is what will work in the long term.
Thank you, sir. And I think we should probably, unless we have really done some homework on it, we should stay within our expertise. I don't think surgical gastroenterologist should be talking about COVID, or pulmonologist talking about plastic surgery or something like that. So, yes. Your closing comments, Dr. Sridhar.
Yeah, I think it was wonderful listening to you, Jimy.
Thank you.
And there's been a concerted effort. I think Vidya has been doing it weeks after weeks after week.
Yeah,
I think it's a great thing. Something which is consistently being done is something which is very, very difficult. I think one day, tamasha anybody can do, but I think I must really congratulate both Radha and Patarada and Vidya Mohan Ram for continuing to really host this and then do this. I think that should be the closing remark rather than on Ayurveda or allopathy, or whether it is misinformation or disinformation. The good information is, I think really we must congratulate both of them for continuing this effort. I think that should be the closing remark from me.
Thank you so much, sir. It's because of the good wishes of people like you and others who log in week after week, irrespective of what the topic is. So thank you so much for your kind words. Jimmy, do you want to reinforce anything that you said during your talk?
I think I've completed most of, everything is covered, except that, see, you need not actually, if you are a proper, if you research properly and put correct information out there, you need not be an expert in that particular thing. I don't think that is really required, because there are so many even journalists, health science journalists who are doing very good work in population science and all that, who are not really experts on that. But the thing is that there is a way of extracting the correct information and presenting it in context. And if you do it properly, I think you can do it. I think it's unfair to say, okay, if you are a plastic surgeon, you should talk only about
I meant, sorry to interrupt. What I was saying is, without doing your homework when you go and talk about, that is my angst. Just to get media time, or, to come on this TV or whatever.
I think that's a very bad thing which we have seen in the COVID times and all that. Everybody coming up and saying a lot of nonsense out there. That I think is totally wrong. But there is a way of doing it responsibly. Then if you are interested in that, only you may be interested. No? So many people may not be interested. Then
only we can do, as medical professionals, only we can do,
Yeah.
I think one thing we can do, possibly we are in many groups other than medical groups. I think possibly a week, we can send one proper message, proper information, without talking about only contradicting somebody else.
Yes.
We know what are the contradictions which is happening. About that, instead of contradicting, give the right information in our groups as a tip for today. Something like that we can start. I think tip this week, like that we can tell, I think this is the thing which you must do. If you have a weakness of your upper limb, or sudden slurring of speech, what you must do. Or if you have a chest pain, what you must do. Something like that, possibly we can give an information so that can combat a lot of misinformation. I think we are capable of doing that. I think one good information every week, possibly we can share.
Yeah, one more thing. Plus, I think we also need a little bit of training to access, correct information. How to search PubMed and looking at citations, looking at what is the dominant consensus now, how has it changed from before, what's the correct context in which this particular thing. It requires a little bit of, training.
Yes, so Basumati had done a session on, how this should be included in our curriculum. So perhaps we'll have Basumati come back again one time to,
talk on this.
Refresh a course on how to get information out of the internet or AI or whatever.
And how to search PubMed correctly is something, because everybody uses it anyway. So that's something which I focus on teaching all the time. So I'd be very happy to do that in a session whenever.
And thank you everybody for a very interactive session. Thank you, Jimmy, for all the, not just for today, but for all the work that you do to put out the right information and, going that extra mile to be of help to society. We really appreciate that. We'll meet again next week with another episode of Marvelous Medicine. Till then, take care and stay safe. Good night.